Dr. Limongelli, we did talk about sleep apnea and the bad effects of sleep apnea. Basically, people who snore, at least most people who snore, stop breathing, and by doing so, get deprived of two things: sleep. Apparently, there's a study out there where people who sleep 6-7 hours really only sleep a couple hours, and those are not even the heavy cases. They're still considered relatively mild. And at the same token, they stop breathing up to 10, 20, 30 times an hour sometimes, and sometimes up to a minute and more, and that is also oxygen depriving. You couple those two things, people literally get neurotic. People fall asleep in the afternoon, have car accidents, and just basically have a much more lifeless life than they could have. How much of that have you observed, and what is your input on that?
I've observed that a lot, and that's one of the reasons why I got interested in sleep medicine. It's important to get a good night's sleep, a good night's rest, without any interruptions. Patients that have obstructive sleep apnea, where the airway is occluded during snoring in the time when they're supposed to be resting and sleeping, actually deprive their body of oxygen. When they awaken in the morning, a lot of them are still tired. This carries out throughout the course of the day. They nod off during different activities. Sometimes they can nod off while reading or looking at television, and in the more severe cases, they can actually nod off when they're driving their car, which can be fatal.
Right.
So it's a very real and a very important thing. The CPAP machines that are used widely to treat this disorder are machines that can be monitored. They have a little card in there that can go into a computer that their physician has, so the physician can monitor if they're using the machines. In the future, the monitoring can be extended to go to employers for employees of truck companies to find out if these people are getting their proper sleep at night, if they're using their machine, and if they're not, they shouldn't be driving the next day. So it can affect their livelihood. But it's a very important thing to get that proper sleep without any interruption or oxygen deprivation from actual apnea or breathing being stopped.
You mentioned the word apnea here. We say sleep apnea, and I think we know what we mean by it. Anyway, you don't sleep. But can you tell us what the word apnea really means?
Apnea means when the breathing stops.
So apnea is
stop breathing.
It means stop. Does it physically mean stop breathing or just stop?
Yes, the patient actually stops breathing for a while.
Okay.
Once the tongue occludes the airway, and there's no air being exchanged, the patient is not breathing at all.
Okay. So now,
eventually they'll overcome that and they'll start breathing again.
Right.
But for a time they won't.
Right.
And as you mentioned before, it can happen a few times in an hour. It can happen a few times in a night. It depends, and that's why a sleep study should be done where they can actually determine for how long and how many times this happens. And then they can determine what category the patient falls into and what type of appliance they'd be best suited for.
Right. But by what type of appliance? So there is the CPAP machine which pumps oxygen into you, and apparently
it pumps room air. It's room air. It's not oxygen. It's room air that's bubbled through water to humidify it so that the air passages don't dry out.
I got it.
And they breathe that over through a mask while they're sleeping overnight. The other appliance is a oral appliance, which looks similar to a sports mouth guard.
Okay.
It's confined to the inside of the mouth, and for patients where their bed partners object to having that noisy thing with the mask on overnight, almost no one knows that they're wearing this thing, because when their lips are closed, you can hardly see it.
Well, you said that the bed part not checked to the noise. I have heard that the people wearing it are the ones who are actually suffering, and they are the one who cannot stand it because they cannot toss and burn. And
there's a lot of
very uncomfortable, and by doing so have a very, very low compliance rate with that mask.
Yeah, that's very true. That's very true. A lot of them don't like it and won't use it.
But not with the appliance a dentist makes.
There's very few that are non-compliant with the dental appliance, because even with the ones that have gone through the CPAP machine first, they find that the dental appliance is much better. Much better. Expose them
to the severe uncomfortable thing, and then get them kind of down. But all right. So once a person starts breathing again, whether it's through the CPAP machine or through the dental appliance, now have you noticed that people simply get more energy, that they now not fall asleep, and that their life literally looks brighter, that the sun shines, that the flowers have color in it again? Is that kind of how you can describe it?
Absolutely. Almost invariably, everyone says they feel a lot better the next day.
The next day?
They feel more energetic. Yeah, the next day. They feel a lot more energetic. It's like the first good night's sleep they've had in years.
And they didn't even know
they feel more energetic, and it's just wonderful.
They didn't even know that they didn't have a good night's sleep, I guess, before, right?
A lot of them didn't, no.
Yeah. And so you have more energy. So basically, we could literally say that, the best afternoon booster is not an espresso, is not the Red Bull to boost your energy up, but it's a trip to the dentist and get yourself a sleep appliance.
Yeah, and there's nothing like it. It's for someone who has sleep apnea, that is the best thing they could do.
Well, absolutely incredible. Thank you very much. Very informative. Bye, Dr. Limongelli.
Bye-bye now.